A trip to Lithuania is one to remember for 73-year-old Charlotte Beard, learning about her family history and where her grandparents are from. It's a trip she was able to take stress-free, knowing she's been working hard to stay on top of her bone health.
About a year ago, I think it was May 2023, I started seeing Dr. Prespo because I had some degeneration, and she's looked at my DEXA scan and she said, you need some improvement on your bone.
Charlotte has osteoporosis, meaning she's at higher risk for breaking a bone.
When we're defining osteoporosis, we use a number called a T-score, which compares a person's bone mineral density to a group of young normal people. If you get more than 2 standard deviations below that young normal group, so a negative 2.5 or lower, like negative 2.5, negative 2.6, etc., on a bone density study, we know you have osteoporosis. But there are even higher risk categories if you're below a negative 3 on that bone density study, or if you've broken a lot of things, then you're in a category that we call osteoporosis with very high fracture risk.
Since Charlotte is in the very high fracture risk category, Dr. Prespo wanted her to start a treatment with bone builder medicines.
So osteoporosis we treat with either bone building or bone keeping medicines, depending on how severe the situation is when we see the patient. So if you're at a very high fracture risk or have broken a lot of things and a very low T-score, then you're going to be, we're going to recommend the bone builders, those stronger, more potent drugs. If you're not at that higher risk, we might start out with a bone keeping medicine.
Along with taking her medications, Charlotte also includes exercise as a way to support her bone health.
Do try to walk, yeah, which helps. Exercise helps.
Keeping the calcium and vitamin D in a good range, doing that weight-bearing exercise can support what we're trying to help your bones do with the medicines that we're using.
And the combination of all of this is already paying off for Charlotte.
I've had a DEXA scan since, and in my spine, I'm 10% improvement.
We're seeing an upshot in her bone density, which is exactly what we want to see. She also hasn't broken anything in the meantime, so big thumbs up there. All of those things point to this being a successful treatment.
Allowing Charlotte to make trips around the world.
The future is going while I can and taking care of my health the best I can, because that's so important. And I think when you're younger, you don't realize that. And then when you get older, you realize that your time traveling, your time doing anything is, the clock's ticking pretty fast. So important to take care of your health.